Morning to all. Today's topic of discussion will be permanent maxillary first premolar. Objective is to learn the morphology of permanent maxillary first premolar and to understand how to carve this tooth. So, introduction. Maxillary premolars are 4 in number, 2 in the right maxilla and 2 in the left maxilla. Named so because they are anterior to the molars in the permanent dentition. And they are also having another term, that is a bicuspids, because of the presence of 2 cusps. And they develop from 4 lobes, that is 3 labial lobes and 1 lingual lobe. And the main function will be premolars assist canines and molars in tearing and chewing. And the maxillary first premolars have 2 cusps, 2 roots and 2 root canals. The buccal cusp is usually about 1 millimeter longer than the lingual cusp. And the crown is more angular and the buccal line angles are more prominent and they resemble the canine from the buccal aspect. Coming to numbering system. So universal numbering system, they are numbered like 5 on the right side and 12 on the left side. FDI 1-4 for the right side maxillary first premolar and 2-4 for left side maxillary first premolar. And Sigmondi Palmer 4 and 4 on both the sides, represented by the quadrant symbols. Coming to chronology, first evidence of calcification 1.5 to 3/4 years, enamel completion 5 to 6 years, eruption 10 to 11 years, and root completion 12 to 13 years. Measurement: cervico-occlusal length of the crown 8.5 millimeter, length of the root 14 millimeter, mesiodistal dimension maximum curvature areas will be 7 millimeter, and mesiodistal dimension of the crown at cervix 5 millimeter. So buccolingual dimension of the crown 9 millimeter, the maximum curvature areas. Buccolingual dimension of the crown at cervix, it is 8, and curvature of cervical line on the mesial surface 1 millimeter and distal surface it is 0 or negligible. So the basic features that differentiate posterior tooth from anterior tooth includes greater relative buccolingual measurement compared with the mesiodistal measurement for posteriors, and the posterior tooth will be having a broader contact areas, and the contact areas on the mesial as well as distal will be more or less at the same level compared to anterior. So for anteriors we have seen the mesial contact area and distal contact area at different levels, and cervical line curvatures will be having lesser dimension on the mesial as well as distal for posteriors, and for anteriors we have seen this like 2.5 and 3.5 on the mesial and distal, etc. And the shorter crown, that is cervico-occlusal length, will be shorter for posteriors compared to anteriors. So for anteriors, like central incisor, around 10.5 millimeter was the crown length, but for this tooth, that is a maxillary first premolars, around 8.5 is the cervico-occlusal length. So these are the various aspects of maxillary first premolar, that is a buccal, lingual, mesial, distal, and occlusal. So first of all, buccal aspect. So likewise we have seen for the canine, the geometrical shape was pentagonal. So for this tooth also, that will be resembling almost like a canine from the buccal aspect. So geometrical shape is also the same, that is a pentagonal. Cervical line will be having less curvature with the crest of curvature centered towards the root. Then from the labial aspect, mesial outline. It is slightly concave from the cervical line to the mesial contact area. And the mesial contact area, it is relatively broad curvature, and the crest of this curvature which lies immediately occlusal to the halfway point from cervical line to the tip of the buccal cusp. So in this diagram you can see with that yellow rounded area, that is a mesial contact area. So the mesial cuspal slope, it is straight and longer, and the tip of the buccal cusp is distal to a line bisecting the buccal surface of the crown. So this is a difference from the canine. So for canine, the distal slope was longer, or the distal cuspal slope was longer compared to the mesial. But for this maxillary first premolars, the mesial cuspal slope is longer than the distal slope. So automatically the cuspal tip will be lying slightly distal. Next, distal outline. So distal outline is straight or slightly concave below the cervical line. And distal contact area, broader curvature than that is found mesially, and the crest of curvature of the contact area tends to be little more occlusal than the mesial. So the mesial and distal contact areas in this picture are shown in different levels. They will be more or like on the same levels can be seen. So the mesial contact area will be having a little more positioned towards the cervical than the distal contact area. Coming about the surface, so labial surface is convex and middle buccal lobe is well developed and forms a buccal ridge, and it starts from the center of the cervical line to the cuspal tip. So for canines we have seen the same feature, that is the labial ridge, but for this a slight name change will be there, like buccal ridge. So the mesial and distal to the buccal ridge, that is occlusal to the middle third, developmental depressions can be seen, which are usually seen that serve as demarcations between the middle buccal lobe and the mesiobuccal and distobuccal lobes. Buccal cusp is pointed and about 1 mm longer than the lingual cusp, and the crown is more angular and the buccal line angles are more prominent. So contact areas are more nearly at the same levels with each other than those found in the anterior teeth. So anterior teeth, there are the different levels. We have already seen this feature, and the width of crown mesiodistally is about 2 mm less at the cervix than its width at the points of its greatest mesiodistal measurement. So for this tooth, there is around 7 mm will be towards the maximum curvature areas mesiodistally, and 5 mm on the cervical area. So next about the root. So root dimension will be like 3 or 4 mm shorter than those found on the maxillary canines. So for maxillary canine that was around 17 mm, but for maxillary first premolars it is around 14 mm. So although the outline of buccal portion of the root form bears a close resemblance to that of maxillary canines. Next aspect, that is the lingual. So crown taper towards the lingual because the lingual cusp is narrower mesiodistally than the buccal cusp. So this feature we have seen in the anterior, that is the lingual convergence. Not that much lingual convergence can be seen for the posterior tooth. A slight lingual convergence can be felt. So a little more mesiodistal dimension short when compared to the buccal cusp for this lingual. And the lingual cusp is shorter by 1 mm, that is a height. So buccal cusp will be having more length when compared to lingual cusp. And lingual cusp is more smooth and spheroidal. So for the buccal cusp we have mentioned that it is more angular, or the line angles are more prominent. But this lingual cusp, it is not that much angular, or the line angles are not that much prominent, so it is felt more smooth and like spheroidal in outline. And likewise buccal cusp is also pointed, lingual cusp is also pointed, with mesial and distal slopes meeting at an angle of about 90 degrees. And the surface is smooth with a lingual ridge extending from centrocervical line to cusp tip. So like on the buccal surface we have seen the buccal ridge. Lingual aspect, there is a lingual ridge also present for this tooth. And the mesial and distal outlines are convex and are continuous with the mesial and distal slopes of the lingual cusp. Cervical line is regular with slight curvature towards the root and the crest of curvature centered on the root. So lingual portion of the crown is narrower than the buccal portion. So like crown surface, root portion will also be having a slight lingual convergence. So hence part of the mesial and distal surfaces of the crown and the root are visible from the lingual aspect. Buccal cusp is visible from the lingual aspect. So we have seen this feature. There is a buccal cusp will be having more length when compared to the lingual cusp. The height difference will be 1 millimeter average. So automatically from the lingual aspect we can see the buccal cusp clearly. Next about the root surface. Mesial and distal outline of the root taper to a pointed apex that is curved distally. So a slight distal curvature can be seen for the lingual root also. And the surface of the root is convex and smooth. And when two roots are present, the lingual root is shorter and narrower than the buccal root. So for maxillary first premolars, two roots are there. There is a buccal root and the lingual root. So out of the two, the lingual root appears little more shorter when compared to the buccal root. So next, mesial aspect. So for anterior tooth, the geometrical shape for mesial as well as distal surface was more or like triangular or wedge shape. But for this posterior tooth, the geometrical shape on the mesial aspect and distal aspect will be trapezoidal. And longest of the uneven sides is toward the cervical portion and the shortest is toward the occlusal portion. And a characteristic that is representative of all posterior maxillary teeth is that the cusp tips are well within the confines of the root trunk. So we can see the cusp tips, that is the intercuspal distance. So that is the distance between the buccal cusp tip and the lingual cusp tip. So it is much lesser. So it is like it lies within the confines of the root trunk itself. So root trunk, there is a major chunk portion of the root. So the undivided portion of the root. So the root trunk extends from the cervical line of the cemento-enamel junction to the bifurcation area. So more or like it, both the cusp, that is the buccal cusp and the lingual cusp will be lying within the confines of the root trunk itself. So from the mesial aspect, two roots are seen, that is one buccal and one lingual root. And sometimes you can see that the lingual root is 1 millimeter or 2 millimeter shorter compared to the buccal root. And coming to the cervical line curvature is less than that seen on any anterior tooth, that is around 1 millimeter. So for anterior tooth we have seen the cervical line curvature like 3.5, 2.5 mm, and distally it was like 1.5 or 2.5. So for this maxillary first premolars, the mesial side of the cervical line curvature it is around 1 millimeter, and on the distal aspect that is negligible or 0. Next, buccal outline. From the mesial surface, the buccal outline curves outward below the cervical line, and the crust of curvature is often located approximately at the junction of cervical and middle thirds. And from the crust of curvature, the buccal outline continues as a line of less convexity to the tip of the buccal cusp. And mostly the buccal cusp tip is directly below the center of the buccal root. So in the diagram you can see a blue line. So the buccal cusp tip will be lying at the position just directly below the center of the buccal root. Next, the lingual outline. So it is smoothly curved line starting at the cervical line and extending till the lingual cusp tip. And the crust of curvature is most often near the center of the middle third. And here the lingual cusp tip is on a line in most cases with the lingual border of the lingual root. That is the yellow line that is shown on the diagram. So the lingual cusp tip will be lying on a line in most cases with the lingual border of the lingual root. And the lingual cusp is always shorter than the buccal cusp, and the average difference being around 1 millimeter. So 1 to 1.5 millimeter height difference will be there between the lingual cusp and the buccal cusp. So mesial marginal ridge is at the level of the junction of middle and occlusal thirds, and mesial contact area is centered on the surface bordered buccally and lingually by the mesiobuccal and mesiolingual line angles. More or less like towards the center of the tooth, we can see the mesial contact area. And a characteristic feature found on the mesial surface is the presence of mesial developmental depression cervical to the contact area, and the depression continues on the root surface and ends at the root bifurcation area. And one more feature on the mesial surface, there is the presence of mesial marginal developmental groove that crossing the mesial marginal ridge lingual to the contact area. So in the picture you can see clearly that the central groove continues as a mesial marginal groove and it extends on the mesial surface also. Next, about the root surface. The root trunk is long on this tooth, making about half of the root length, and both buccal and lingual roots have straight outline with blunt or pointed apex, and the root is bifurcated for half of its total length. So 14 mm is the total length, so around 7 to 8 mm bifurcation area will be there, and 7 to 8 like root trunk will be having like 7 to 8 mm, and smooth surface except for the deep developmental groove and depression at or below the bifurcation. So next, about the differences from the mesial aspect for distal. So on the mesial we have seen about the mesial developmental depression on the crown surface cervically, but in distal aspect we will not be able to see any such depressions. So a flattened area just cervical to the contact area can be seen, and cervical line curvature will be having a 0, or mesially we have seen around 1 mm crest of curvature, but distally that is less cervical line curvature will be there. Then on the mesial, there is a mesial marginal developmental groove was present, but distally no such groove is present, and mesial developmental depression was seen on the root surface which was deeper, but for this on the distal aspect no such developmental depression is there, and if present it will be having a lesser depth when compared to the mesial surface, and no developmental groove is also seen on the mesial root surface. Next, to the occlusal aspect, the geometrical shape is hexagonal. So hexagonal will be having 6 sides. So the occlusal surface of maxillary first premolar is circumscribed by the cusp ridges and the marginal ridges. So the 6 sides will be made by mesiobuccal cuspal ridge, distobuccal cuspal ridge, mesial marginal ridge, distal marginal ridge, mesiolingual and distolingual cuspal ridges. So the characteristic feature from this aspect is the crown is wider on the buccal than on the lingual, and the buccolingual dimension of the crown is much greater than the mesiodistal dimension, and the distance from the buccal crest to the mesial crest is slightly longer than the distance from buccal crest to the distal crest, and the distance from mesial crest to the lingual crest is much shorter than the distance from distal crest to the lingual crest. The angle formed by the convergence of mesiobuccal cuspal ridge and the mesial marginal ridge approaches a right angle, and the angle formed by the convergence of distobuccal cuspal ridge and the distal marginal ridge is acute, and the mesiolingual and distolingual cusp ridges are confluent with the mesial and distal marginal ridges, and more of the buccal surface of the crown is seen than that of the lingual surface. From the occlusal aspect, other features that can be seen include developmental grooves, like central developmental groove can be seen, mesial marginal developmental groove that crosses the mesial marginal ridge and ends on the mesial surface, then mesiobuccal developmental groove and distobuccal developmental groove is present. Then 2 pits can be seen, there is a mesial pit and the distal pit at the junction of the grooves. Then 2 fossae, again that is a mesial triangular fossa and distal triangular fossa is present. So mesial triangular fossa is distal to the mesial marginal ridge and it harbors the mesiobuccal developmental groove, and distal triangular fossa is like mesial to the distal marginal ridge. And 2 triangular ridges can be seen, there is a buccal triangular ridge and the distal triangle, so the lingual triangular ridge. So buccal triangular ridge is prominent, arising near the center of the central groove and converging with the tip of the buccal cusp, and lingual triangular ridge is less prominent and it also arises near the center of the central groove and converges with the tip of the lingual cusp. And when these 2 triangular ridges meet transversely, they forms a transverse ridge. So the buccal and the lingual triangular ridge forms the transverse ridge in this tooth. So just mentioning about the root canals too. So we have already seen that two roots can be seen, that's the buccal root and the lingual root, and the lingual root is shorter when compared to the buccal root, and inside root you will be having root canals. So two root canals will be there for this maxillary first permanent premolars. Okay, thank you all.